一个就是给你资料，怎么样防止病人跌倒。
And afterwards, I will pass up the actual article from John Hopkins that we used.
他一会儿讲完之后，他会给你们资料。John Hopkins 是美国一个很出名的医院，他们做这个 program 的，他们给你的。
Do you need anything else, Judy?
I think I'll be okay.
You think you'll be all right? Okay.
Oh yeah, I didn't bring my flash drive, but I could just go online and just show them.
Okay. The sensitive means that nursing is responsible for you. Baseline means that it's a starting point. Judy, at 9 o'clock, other people will be joining us, just so you know that. So
Okay. I can
start
still talk,
whenever
though?
you want. Yes.
Good morning, everyone.
Good morning.
My name is Judy McHugh. I'm from Nursing Quality. And I feel as a nurse, I'm a patient advocate. I'm not on the floors taking care of the patient, but I feel that I can have an impact.
他是主要是帮忙病人的，有什么帮忙不满意的找他的了。
We'll begin with this particular handout.
这个你这里的刚刚进来，他开始讲这个。
I was asked today to talk about how to access some of our quality information sites. I thought I would start with this and then talk about what I do and kind of how it fits in with nursing quality.
印出来样本给你们看。
Here you can actually look through the ventilator bundle, the checklist. These are information, for example, with the critical care to improve ICU patient care with the ventilators. With this one in particular, there's 4 things that must be documented.
他举例就进去那个呼吸那个机器怎么样减少有4个事情去减少它不会有发炎啊之类。
Does anybody have any questions?
你们有问题吗？
I heard that I can compare the information about the hospital between the hospital.
他会一步一步。She's getting there.
I think that's the CMS.
Yeah, that's hospital compare. I'll show you that in a minute. And we do have some nice slides on that.
Okay.
Additional information here on the bundle that you can look at your leisure, but for the interest of time, I'll now go to hospital compare.
他现在就去你刚才想要的了。医院的比较。
不是在这个网站。It's not this website.
So it's a different website, right?
Yes.
Oh, okay.
Hospital Compare is a government website. It's called CMS, and it's Center for Medicare and Medicaid Services. They govern the health care. Also, they're the ones that pay for the Medicare and Medicaid. The Medicare is for the elderly patients, and Medicaid is for the poor patients who do not have health care.
Medicare 就是年老的人，60几岁以上的政府的保险。Medicaid 是穷人，第一个是老人，第二个是穷人。
You know, I'm going to refer you to the handout because right now I can't find this particular slide, so I don't want to waste the time. But if you can take a look at this particular slide where it says click on Find and Compare.
就是看你的一页，你对的了，你在这边，因为他在网上电脑找不到 ，Find and Compare Hospital， 就是找医院来比较。
We're going to look at the paper here.
他们就看纸了，他找不到在网上。你这边就是比较医院。
对，我知道。
With Hospital Compare, we can take a look at any hospital that is in this database.
他可以看到资料里面有医院。
We can go by location, by the state, or by a portion of the state. We can just type in the information, and it will actually populate. And as we go through the slides here,
他怎么找都可以的。其实你把那个州那个医院在哪一个州，你去比较。
And as you can see on the bottom slide here, I clicked on for Loyola.
他找到 Loyola， 就是在 check 那个 Loyola。
And then the next slide, it actually shows you can take a look at slides for surgical care and improvement. And in this one in particular, it's on antibiotics prior to surgery.
这个你看你自己的图了，他就是找surgical patient，现在他找是防止感染，开刀之前怎么样去防止感染。
And as you can see on this slide, we are compared with averages for all hospital reporting in Illinois.
它就是比这个下面就是右手边下面这个图，就是所有伊利诺州的比较。
They're at 82%.
平均来讲，在这个州的医院就是82%。
And as you can see, Loyola is at 98%.
他们的就是98%。
This is just one small indicator that the public can access on this
所有人在美国，所有人呢其实都可以看的，他们选什么方面去看，就可以知道那个医院做的怎么样。
But there are many indicators there in this all public reporting, so everyone can see this.
还有很多其他的，每个人都可以看的。
可以问一下，那个医院的比较的话，这个我有上网去看过了嘛？那它跟那个 IHI 的话，那个网站的差异点是在哪边？
它不同的是在哪边，是不是？
对，因为那个是比较医院的，它是 Q 那个，因为它上次提供这2个网站嘛，那我们还是搞不清楚它这2个差异是在哪边。
你是说 IHO 跟这个？
对，不是该 compare 这个什么医院 hospital 那个。
They want to know the size the difference between the size. Like right now we're doing hospital comparison. What is IHI? Give you what kind of type of information?
There are 3 different agencies. They have 3 different databases, and everybody collects data a little bit differently. And we are a member of all of them, and we have to constantly look to see how we're doing.
他说就是不同的机构了 ，IHI 有他机构，有3个不同的机构，
就是
他们拿
他们
的资料，看他们哪方面不同，所以
内容是不是大同小异啊？是机构不同。
所以他们3个都会看他做的怎么样。But are they similar information?
They're all related to quality, but some take it from the community area, some give funding, some are just hospital databases, and because our hospital is so big, we need to look at all of them.
有一些就是社会周围的资料，他那个机构收集；有一些机构是看看他拿多少钱，有一个就是看看他做的怎么样。所以因为他们整个医院这么大，所以他3个网站都去看的，看他自己做的怎么样。
他们有没有说有共同，也是拿一样的东西出来比较的？有没有共同
？The 3 sites, do they have a common category?
No, not necessarily.
不一样。
没有。
Just quality. Quality is the one that unites the
项目没有重
3
叠
of
就
them.
是了。
So they don't have duplicates, like the 3.
No, for example, like the AHRQ, that is research that we either can participate in and/or as a resource. For my department, we use AHRQ as a resource to look at guidelines.
Okay, hold on.
That's okay.
他说第一个呢，最重要啦，是给他们资料的，他们去研究，就从第一个去拿，研究可以有什么，最主要是拿资料的，拿资料的。So you mean AHRQ do not have hospital comparison?
No.
That's right.
Okay.
Right.
所以你想看到医院怎么比较，你就不会去第一个了。
IHI 是
第一个。
是第一个 HI。
Main thing IHI
It's the patient safety initiatives.
所以第2个呢，就是主要是病人安全方面的。
IHI 是主要病人方面的。
And then hospital compare is the only place where you can get the data from hospitals to compare with one another.
Hospital compare 是医院比较，就是只可以比较医院。
就在这一个网站而已。
对。
然后它不是要有权限嘛？比如说有些人是看不到的，是哪一种网站呢？好像
which site public could not just go in and get
可以看得到的内容的上面。
Which public?
Which 网站 which site which
About information related to a hospital?
Yes, but the public cannot see. You have to put in a password, your ID.
There are some information in IHI that is, that we have to load information in. So what I gave you is stuff that everyone can access and see. But we also belong to another organization called University Health System Consortium, and we share our data, and that gets compared to other academic centers, and that's private.
它有的 University Health Consortium 就是外面不可以看的，就是只有他们医院的人，他们 so you need a password and ID to get in.
Right.
所以只有他们有那个 password 啦，他们要放他们是谁呀才可以看的。
那个里面有什么资料？
What kind of information is there?
This one, patient
It would
safety
be
too.
mortality, morbidity, infection
Oh.
rates, anything related to our surgeries, our medical conditions. That would all be in there, and that's data that we report. And what Judy gave you was only what you could pick up from the public domain. Okay, because we're a member of other databases, but they're password restricted. We didn't show you those. The UHC and NDNQI, we didn't show you those because you need to be a member.
The information that I have in here is just to talk about nurse-sensitive indicators, but we actually have a password where we load all of our fall information, so anyone who fell goes in there and asks detailed questions regarding the fall and the patient. The same thing as pressure ulcers. That is private information, and we do pay the company for that services because we get that benchmark from UHC and also from NDNQI.
所以他现在告诉你的，就是你可以看，是有一些网站是他们才可以进去的，只是网站资料可能几次一点，病人的资料在里面的不可以，虽然都可以看到。
Okay. I've also provided additional information that when you're in this website, you can click on the tabs, and it'll give you definitions, and it'll explain some of the measures.
定义，你说你可以按一下那个定义。
Are we on NQF now?
We're moving on. Okay.
So we're basically
NQF is National Quality Forum.
国家的表格，你可能想要的，全国的表格。
With this particular site, it talks about measures.
这是指标。
And as you can see, I provided patient-centered outcome measures. They look at death among patients, fall injury. This is an organization that works together with an expert group.
Expert group，
yeah, nursing experts across the country.
就是专家，护士专家，一般护士专家，在里面。
They evaluate the indicators and also to see if these are research proven that your nursing care is affected by the patient care.
他们就是看研究的结果，证明一些护士怎么照顾病人，证明他怎样行是对的。
他是说这个是有一个格式，就是还有一些指标了在里面的，是不是？
格式。
跟指标。
form。
And as you can see in the slides, there's nursing-centered interventions such as smoking cessation, measures of percentage of patients with history of smoking. Then also there's the system-centered measures, which is how many nurses, how many patients per nurse, and also nursing care hours. This information is on the slide.
它有指标，就是一个病人一个护士多少个病人，就是在这边看到，他是研究之后觉得一个护士应该多少个病人，就是给你们指标，医院指标。
My next website is National Patient Safety Foundation. This is a non-for-profit foundation. All you need to do is just do NPSF and it would pop up. You double click on it. Information here is on safety organizations, and as you can go down through the search on your left-hand side, You can see that what research is done.
左手边你就可以选你的题目，他们做了什么研究。
Some of the grants that they are working on. And also, this is also a site for if you wanted to go to a conference, and also has resource materials.
这边就会有资料，去开会有什么会什么时候开，你可以去看看，你就参加报名参加。
Does anybody have any questions?
有问题吗？
Again, this is another resource.
You mean this is research? You can find here.
You can find some information.
Yeah.
My next website is ANA, which is the American Nurses Association.
这是美国护士会。
Okay. This particular website has a wealth of information. In addition to what I was going to talk about when it comes to nurse-sensitive indicators, there's information about the American Nurses Association and actually becoming a member, information specifically for the nurse practitioners, educators, and
它这边有很多资料给 nurse practitioner, and I'm sorry, I used the last, and resources for nurse practitioner and
for nursing and nurse practitioners and
给
两个都有，护士跟 nurse practitioner。
What I wanted to do is go directly to the nurse-sensitive indicators.
就是护士应该做的指标。
I'm used to using a mouse. For some reason, the ANA website is slow.
这个很慢，等一下。
It's coming.
Come on in. Come on.
And as you can see here, this talks about the nurse-sensitive indicators. We briefly talked about NQF and the experts, nurses that talk about nurse indicators and how it affects nursing care. The ANA can work with the NQF, and they look and they take those indicators and they actually would put these into study if they felt they're important. Some of the most important in-hospital patient indicators would be falls and also pressure ulcers.
这两个机构 ANA 和 NQF 一块去做的，譬如好像跌倒是他们都要研究的事情。
What I provided for you is a handout on the background of the ANA and also the nurse-sensitive indicators, and it talks about quite a few quality initiatives that they focused on with education and research.
那个 ANA 他给你一个文章，就是它的背景。
One of the things that they felt important, that was important, was to, in addition to patient falls and skin, is also nursing care, and how many hours the nurse works with that patient and the skill mix. So how many nurses and patient care techs, how many agency hours. Additionally, in order for Magnet, we worked and this is another handout for you, we are required to have at least 12 nursing indicators. And with these indicators, you can see, go ahead.
In the back? Oh, I see. 所以他们就另外一张纸啦，它主要那个 ANA 是怎么帮助护士的？好，譬如呢，他觉得护士不应该做太多时间啊，里面有讲，护士应该多做个多小时啊。这一张他给你呢，就是有12个他们的责任呐、他都写了出来了，有12个在里面。
One of the things that I'm personally involved in is fall prevention.
他有一个要做的就是防止病人跌倒。
Fall prevention is a national patient safety goal. It's number 9.
这是在美国是第9。
And every year, there's an organization that gets together and looks at sentinel events.
What event?
Sentinel events, and they evaluate these sentinel events, and then they bring them forth to a national patient safety goal.
他们有班人每年有班出来研究。
Are they familiar with national patient safety goals?
病人的安全目的，你们有没有？
Sentinel event.
Yeah. So if the patient falls and dies. So they looked at that data, and there were several. So then they decided to make that a national patient safety goal.
因为病人跌倒他死的话，所以他们现在很注重他定了全国的病人安全的指标。
跌倒没事，跌倒死，跌倒死，这样没有指标。
What I also wanted to show you is 2 things: is the how nursing is reported up through the organization.
它里边你可能想看的就是护士的组织，谁报告谁，谁报告谁。
And with this handout, this is the Loyola University Health System Board. And as it goes down, you've got the Quality Patient Safety Committee of the board. And then it has the Quality Safety Council. And then it goes through the operations. And as you can see below, here's we have environmental health and safety, patient safety and risk management,
有很多的不同的
nursing quality department,
要做的，一个报告给上面那个。
also has nursing quality steering committees, patient care service lines, and it goes all the way across to medical staff committees. We have a Loyola shared decision-making structure.
大家一同的做决定是这样子的。
Okay. And as you can see, we have councils.
它有
Nursing council. One is executive council, nurse executive council, and also the Magnet Ambassador Council. The Magnet Ambassador Council is where we have nurse representatives from all different departments and units.
那边就是所有部门的人都有一个代表去参加。
Okay. And this information, what comes at these meetings, is disseminated down to all of the other councils. And through the councils, then, that information is then further disseminated down to the smaller groups, which you can see down here through the, whether it be the clinical ladder, patient safety committees, journal club. We have, I believe, 5 different nursing councils that nurses can represent themselves. One is the Nursing Quality Safety Council.
它有，就是一步一步的看到它的组织是怎样子的，护士都有自己有参加的，
The Research Council, Nursing
研究
Research.
的部门会。
And then also we have the Education Council, Professional Practice.
教育的。
And we have we have a Manager Council and also Nurse Practitioner Council.
管理的，nurse
And then way down below is we have the subcommittees. There's committees below the council. For example, I am working with the Nursing Quality Council, and I'm working on the dashboard. For the hospital, we wanted to provide a 1-page document for the nurses.
他也做那个护士的品质。我想他的 dashboard 就是印出来一块的给他们看的结果。
And through this, we have additional participation with these committees, and the nurses are working on a dashboard, which is that sheet of paper that has all of the quality data for that particular nursing unit or department, such as falls, pressure ulcers, infection.
每一个部门他们所的结果，跌倒的结果是怎么样，是放在院子上面。
And at the base of all the committees is the unit-based committees. So all of that feeds up to the councils, which feeds up to eventually to the board of directors.
就是从下面上去了，上面是最小的，一步一步的报告上去。
Does anybody have questions?
Report is use the paper.
We use the computer.
And if I can get into
If you want to get into reports, General Judy,
Yeah.
is that, yeah,
Yeah.
go ahead. Go right ahead.
报告了，看他们的报告。
Some report indicator is common, some is special. I mean maybe
Like
4 is
pressure
and 4 is the common. The same 就是共同的。
Common. That like pressure ulcer criteria is the same regardless of where it is, yes.
And
Some
some
units
units
are very specific for ventilator-associated
Yes.
pneumonia. You have to have a ventilator, therefore it's restricted to the critical care areas.
So just 2 is common.
Pressure ulcers, patient falls, and restraints, those are our common ones.
Okay. 就他们这偷懒的时候。
对呀。They all have to report up here.
just briefly go through. I wanted to show you information that we collect. I have nurse representatives from different departments, and they actually collect information on pressure ulcers or information on nursing documentation.
他每个部门都要向他报告一些肉仓什么的一些档案，都有交给他们。
Instead of having a paper document, we have everything online. The nurses will have all the instructions on this form, and they would complete this information with just the patient's medical record number. Everything's populated through the admission discharge database. I can't show you a real patient, but...
这个就是他们刚刚讲的电脑的系统嘛，就是表格，他们将那个病人的资料全部填在里面。
And these are questions that that we would ask upon admission if they're looking at the patient database,
那个
admission database.
问题就是他们进来的时候就问一行一行的勾的。
Some of the questions that we are collecting here, this information we are collecting, is because of Joint Commission or because of CMS, the government, is
有一些
requiring us
资料
looking
他
at
们
this
需
information.
要问病人，因为他们要报告上去给一些组织。
是在电脑里面勾嘛，勾一勾的话就自动那个传送到，有问题的话知道主管那边去。
So they just check all the questions in the computer, and the data will be populated through different departments or whoever wants to read it.
And then all we would need to do is just pick out one particular unit.
他们只选一个看看。
I need my mouse. And this is the information that you would get as the number and the percentages. And the nurses have this information at their fingertips.
不是，他电脑里面都有这些资料的了，他一打开就可以知道。
And as you can see here, we are collecting quite a bit of data because of either it's just good patient care or because of Joint Commission or CMS. And some of them would be restraints, pediatric IV, infiltrations, hand washing, hand hygiene, patient handoffs. These are all information that is required for us.
右左手边呢，就是你可以去哪里看那些不同的资料。
这是全面性的病人嘛，全面就是。
One of the things I wanted to show you, because I know we're for interest of time, is that we have all our information.
这资料全部都有，你想看什么？
我要问他说，那个所有不同的指标的那个项目是，就是说问卷是不是不一样？就是勾选的
So
内容
on the left hand side, the title is different for different kind of disease.
The title is different projects that we're working on, such as restraint use, falls, there was pressure ulcers, or the national patient safety goals, such as handoff, verbal telephone orders. Through the Joint Commission or through the CMS, we are required to collect certain data. So we have the nurses on the units collecting the data and putting it into the computer.
But the title, the forms title, the different reports, you can select it from the left-hand side.
Yes.
And are those standardized for all type of patients?
Well, for the RN documentation, we have 3 different. One is for adults. There is another one for pediatric, and also there's another one for newborn. So not everything is just
有
one
3种
particular form.
你打开那个电脑，有3种不同的要问的问题。成年人、小孩子跟刚刚出生的，有3种不同的。
就只有3种这样。
So it's only 3 types. Okay.
Additional information is once I process the information, I provide reports that the nurse managers and the directors can have access to.
他有了这些资料之后呢，他就做报告，那些上面的人可以看到。
This also is protected by a password, so only the manager directors can
所以
look at this
这个不是
information.
每个人都可以看到的，就是他给他的上面的人看的而已。
And what I will be showing you is the UHC benchmark as well as some of the NDNQI benchmarks. I know you guys were interested in benchmarking with nurse indicators.
它 UNC bench 另外一个就是指标啦，它的指标他们应该达到怎么样？
Can you blow it up bigger, Julie?
Sure.
这是什么指标？
Maybe minimize
他
the
没有
other
讲，
screen.
他没有讲。
问一下这是什么指标？因为我看是每个单位嘛，到底是里面是什么指标？
So what is
他
this
刚刚打的是
particular
4，
one?
我刚刚他答案是4，跌倒。
What is this showing, Judy?
This is showing patient falls on a unit.
跌倒。
And what I wanted to show you is the lines here. Can you see the lines?
那个线。
With the lines here is the blue line is here is where there's patient falls.
那个蓝色的是yours, right? The blue.
Yeah.
Okay.
This
他们的。
When we developed we saw that there was a fall problem, and we developed the Be Safe program that I showed you earlier.
他也又讲了，但是看到这指标，就是很多人跌倒了，所以他们就做一个研究。
And as you could see over with the Be Safe program, implementing bed alarms, doing a lot of education, you can see that the fall actually, the rate actually dropped.
他们所以知道他做的不好，他就做很多其他的事情去防止病人跌倒，好像床边有警号啊，所以看到他做的好了，做了那些东西之后。
This red line is the benchmark with NDNQI. That is the national database what we're benchmarking against medical patients, medical type
红
patients.
字我们看不到红字，就是他们应该起码做到那边的，就是 NDNQI 它的指标。
We are comparing ourselves
NDNQI
We are comparing ourselves to 500-bed hospitals.
他们比较就是起码，那医院是起码有500个床的医院。
Okay, and as you can see, with this particular unit, they're below the red line. They're below the benchmark.
有一些医院红线下面就是做的不好了。
Additional lines is this is the upper and this is the lower. We want to keep our fall rate at this little gray line down below, which would be like maybe 1 fall
所以
per
他
quarter.
们起码就要做到最下面，他们想做到最下面的，意思就是说，最多只有一个跌倒。他想做到啊。
With NDNQI, we have different unit types. There's a medicine, med-surg, surgical, rehab, and intensive care.
NDNGI 下面呢有药啊，有药研究啊，开刀啊，跟 rehab。
For additional information, you could go to the ANA, the NDNQI site, and they could give you you could get information on the different types. But I also have that in your packet.
所以，譬如呢，你去 ANA 也可以看到 NDNGI 一些资料。
你刚说给药开刀的是
他说有5个不同的地方。
对。
What do you mean by 5 different under NDN?
The care level is different in all the unit types.
你对怎么样去做不同啊？
And the population is different. So the med-surg population patients would probably be at more risk for falls. So you wanted to compare all med-surg units across the nation.
因为他们都不同的东西，你比较着不同啊。
Just like you would want to compare your intensive care units.
好像你就是用那个紧急病房的比较。
ICUs are less likely to fall. Maybe they're more likely to have pressure ulcers. So you want to make sure that you're comparing the American term apples with apples, orange with oranges, not apples and oranges because they don't meet.
所以 ICU 呢，可能跌倒就不会很多，可能感染就比较多一点，是刚刚忘了。美国的讲呢，就是不要比较来讲，同样的东西去比较，不要用不同的东西去比较。
More questions? Was this helpful?
我要问的刚刚的问题是说，那个如果你有给药又有跌倒又有什么，是不是所有的指标的问卷都在同一张里同一种的？因为他会说分3种嘛 ，A 打的 newborn 跟那个跟 ADH 嘛，但是他们有的是给药，有的是跌倒，有的是他们是不是每一个是不同的问卷，还是都在同一张里面就可以问？懂意思吗
Okay, you have 3 type of form for adult, children, and infant.
Mhm.
So you ask all these questions, for instance, fall. Would
Now-
that be all in all those forms?
No, it would just be for the nursing documentation.
For adults.
For adults.
Yeah.
This is the RN documentation.
And then-
We're required to
所有
look
的
at the
指标都在那个问卷
admission,
都
the
可以得到。
hospitalization, and the
譬如
discharge.
说
给药就给药的
跌倒，就是只有成人有那个问题。
不是，我现在问说，给药错误的问卷跟跌倒问卷是不是不同的？这样子而已，对不对？
They'll measure pain in all those populations.
I mean,
Yeah,
yeah.
she's asking, medicine, will that be the same in all three forms?
No.
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 Because medicine or med-surg would be the adult patient. The pediatric would be pediatric. The reason why we have three different forms for the nursing documentation is because when we're admitting an adult patient, it would be different than admitting a baby. When we're admitting the baby, we're doing the head circumference, we're doing other measures.
I mean the medicine error and the fraud is the questionnaire is all the same, all together, or just separate. The questionnaire.
The questionnaire
yeah.
after a fall,
Yeah.
is it the same for all populations?
Yeah, yeah.
Yes.
Yes.
All the same. 这样子。
Our fall, we have a brand new fall prevention program for the adult med-surg. And we're now, once we've just implemented this particular fall prevention program, we are now going to look at a pediatric population. Because the pediatric population is different when they're at risk for falls, and that's something that we are doing looking at research to see if there's a validated tool.
他现在做的这个是成人的跌倒的project，然之后他们就其实正只是做小孩子。
Any questions?
有没有问题？
Okay, we brought everyone in that you have met during the past week because we have about an hour to do questions and answers. And I'm going to ask everybody to join us at the table if you can, so that you can have face-to-face with our visitors.
这些人你们都见过的啦，有什么问题，请现在问他们，大概有1个小时。哦，可以。
You might want to stop.
可能现在不要。
Yeah, we don't need to film anymore.
应该不要。